This woman, Abigail Shrier, just published a book titled Bad Therapy that's been getting a lot of attention. And if I try to really simply make her point, because her point is pretty simple, even though I think most people don't get it, even a lot of therapists don't get it, and it's really important. Her point is simple. It's that humans, this isn't her point. This is my way of kind of analyzing, I think, in a more sophisticated way. If you imagine a kid growing up, kids sometimes need to be hugged and have their backs pet and said, "Oh, buddy, you're so great." Kind of, they sort of need this soft reassurance love.
Okay.
And sometimes kids need like tough love. Like, "Hey, buddy, stop whining about it. Time to get back to work." And that's kind of this trick in parenting, is balancing out. I'm always calling it the yin and yang of parenting, but like soft nurturance love versus tough love. It's the most important, difficult part of parenting, is knowing when to do which one and how to integrate these two.
Okay.
And a lot of parents don't even get that. Increasingly, white, educated, liberal parents just do more and more of the soft parenting of their kids. You and I have talked a lot about that.
Is this about parenting, or is this just an intro? No,
this is just an intro. I'm just using the parenting thing to as a metaphor for therapy.
Okay.
So therapy, the same thing. A person comes in and they're complaining about their life. And a therapist, you can give them empathy, or in theory, you can be like, "Yeah, dude, it's hard, but you know what? You need to like try X, Y, and Z."
Oh, yeah.
And as a therapist, people want the soft empathy, and that's what they come to therapy. They think they're going to get that. They're paying you to get that. And when you shift as a therapist and give them the more tough love thing, it's not the easiest thing to do. And sometimes patients don't like it. But really, most patients are at some point, to some degree, are going to need this more tough love thing. It's like, "Hey, dude, stop whining about how hard the dating thing is going and get on a diet and lose some weight." Or get off your ass and leave your house and go out there and start trying to talk to some women. Or whatever it is.
Yeah,
like, some people need that. Everyone needs kind of tough love at some point in their attempt. So Abigail Shrier's book, Bad Therapy, is very simply pointing out, I think, the truth that therapy has mostly become the soft love, and that therapy, if it's just empathy and just, "Oh, how do you feel?" or your trauma, let's go in and give compassion to your trauma. If it's just that, it can be really bad, and it can actually fucking make people worse, which I think is totally true.
How? How does it? I instantly think that I understand how this is potentially a problem, because my practice very much lacks that empathic attunement. It's like, what am I saying? I'm actually just frequently, I think I'm more like David Goggins than, let's say, who is one of the more emotional? Carl Rogers, yeah. Well, no, I'm a total humanist too, though. But I attune super quickly, and then within the first session, start to point out, like, all right, here's where things are going to get rough. Like, this is my prediction. Maybe I'm wrong, but look at this. This is probably going to be brutal, and it's going to be a lot of hard work. You down for that? I'll check in the first meeting. Like, this might be really challenging, and here's what I think.
And Abigail Shrier's point is that most therapists don't do what you're doing, and I think she's right. She gives some examples. So she went and she interviewed a lot of people in therapy, and she gives some examples. Like, for instance, there was this 15-year-old girl who'd been in therapy for 9-10 months, and they were processing her trauma. And what her trauma was that she had dated a boy for 2 weeks, and then he broke up with her. And then for the next 9 months, the therapy was processing her trauma. And so the therapist is like, well, let's get into how you feel about that, and helps the person get more and more into their feelings and feel their feelings and express their feelings.
Whoa. And
in this case, at some, when a 15-year-old dates a boy for 2 weeks and then he breaks up with her, yes, they have feelings for a little while, but at some point fairly quickly, it's like, all right, forget about that bastard, move on to the next one, bite your fucking lip and move on, you know?
Right.
And a lot of fucking therapists don't do that.
Yeah, okay. I can absolutely agree that I have run into these people. I've had lunches with them in the dozens, and
Yep.
I'm quite aware of that posture. And I think it goes actually much further than just this type of potentially overly coddling and overly, I think, what we'd call like medicalizing feelings. So that anything that's uncomfortable, anything that could be potentially stressful, anything that you experience like sadness is somehow pathologized instead of just being like Rogers and saying like, oh yeah, this is part of the human experience. I think that maybe is more fits within the American existentialist movement, where it's just like, hey, this who is it that promoted radical acceptance? It's just not hitting me instantly, right?
I forget.
It doesn't matter.
Maybe Maslow, but I forget.
It doesn't matter because that forms of that concept have been around for quite some time. And to do this alternative type of therapy where you're going to have to just acknowledge like, whoa, I came here hoping that you would give me the toolbox. Because that's what it says on everyone's website, right? Yeah. In 10 sessions or less, here's a toolbox to regulate your emotions and get rid of anxiety. That whole speech, which I think people should stop saying, that causes people to come in with the expectation of, I'm here, you give me the secret code, and then I will then go and act out this code on my life, and then I'll win and make $1 million and have all the things that I have wanted.
The younger generations have grown up in sort of a therapized culture where everyone thinks they have an anxiety disorder or they have a depression disorder, and everyone thinks they have trauma, and everyone is like, oh, well, that's my trauma. My trauma makes me anxious. And that's just kind of spread as a common conception. And increasingly young people, it's almost like their identity is like a person with an anxiety disorder or a person with trauma who needs therapy. And what you do in therapy is you go in and you talk about your feelings and share your trauma, but you don't ever really get over it. You just kind of like dwell in it.
Yeah, what would be like an alternative approach for let's just say a 14-year-old girl or a 14-year-old boy who has this anxiety, depression, and somehow he's traumatized because Becky broke up with him after 2 weeks? Like, what's an alternative?
I think there's I think a good and I think Abigail Shrier kind of fails to acknowledge this. So I don't think she does a super good job at this. I think there's plenty of good therapists out there, and I think any good therapist has lots of different tools in their toolboxes, and one of them is holding compassionate space for someone's trauma or helping them feel their feelings and validate their feelings. That's one tool in my toolbox as a therapist, but I have a lot of other tools. And a different tool that is necessary for the 15-year-old girl whose boyfriend broke up with him after 15 minutes is it's sort of like containment is maybe a clinical world. It's like, yeah, sweetie, that's hard. I hear you, that's hard. Okay, let's focus on something else. Let's move on to something else. I think there's sort of a temper tantrumy, emotional, hysterical. Actually, the word hysteria is probably good. I think there's like a emotionally hysterical propensity in all humans.
Sure, yeah.
And that can, and you imagine like a 2-year-old having a temper tantrum or an adolescent having a freak out because Jenny likes Billy and Billy likes this and like this hysterical thing. That's a normal thing. And parents and therapists sometimes need to contain it, which is like, okay, yeah, you're really excited about this. All right, time to calm down. Time to do your homework.
Yeah, what is that?
And it's sort of like stuff your emotional hysteria, stuff it, put it in a closet, close the door, and go do your homework. And that, I'm calling that containment. I don't know if that's the right word.
It's compartmentalizing.
Yeah, something. It's a different parental or therapeutic response that youth needs, and actually I think adults need it too.
Oh yeah.
And it's kind of the opposite of like, hey, let's get in touch with your anger, or let's get in touch with your sadness, or let's get in touch with your trauma, and let's really like open it up and bring it out and let's feel it. Those two things are kind of opposites, and there's a place for both of them.
Right.
Abigail Schreier's point is therapists do way too much of one and none of the other, which I think is probably true of a lot of therapists, but it's probably more true of pop psychology in the Gen Z fucking generation.
Yeah, well, certainly I'm not going to say that it's entirely the cognitive behavioralists' fault, but they were the ones who absolutely manualized treatment along with DBT, right? With Marsha Linehan's fucking trash there. Like, okay, I'm not going to be such a jerk about this, but I am formally trained as a cognitive behavioral therapist and a behaviorist before that. And so like I'm super well versed in this territory, and I'm quite aware of the fact that this particular approach has given everyone a terrible idea that it is the patient's responsibility to then do the homework and follow the protocol, that the manualized treatment that was created by CBT, right? Which means manualized treatment just means like, oh, you have an anxiety disorder. Which anxiety is it? Social anxiety. Okay, treatment session number 1 is going to look like this, and then session number 2 will be like this, and session number 3, 4, 5, 6, and then by 10 we're high-fiving about how you've now rehearsed the relapse prevention strategies. And it's like, yay, all in one, complete, good to go. This is a terrible idea. It mostly doesn't actually work. It would, of course, it works for some people, but there's a problem, because then it also, after 10 sessions, when you go home as the patient and then you realize like, wow, I'm still super freaked out, and then it's almost like the responsibility is then put back on the patient. It's like, well, you didn't follow the instructions properly. You weren't paying attention in therapy. You didn't read the books that were given to you. You didn't do you.
It just makes me think of there's like more victim self narratives versus more I'm in control, I'm a warrior self-narratives. And man, the psychological state is so different in those two worldviews.
Yeah, it's just like a really different message that we're kind of telling ourselves.
Yeah. Well, part of like a liberal or woke or what a new ideology out there is that successful, strong, heroic people are bad and victims are good. And if we bring that to bear on this psychology thing, like being a victim and having an anxiety disorder or depression disorder, or being a victim of trauma, that there's something, those people are better. It does seem like there's a certain culture that is kind of celebrating and encouraging, focusing more and cultivating more your trauma and your victimness.
But those people could not have had any actual major depression, any severe anxiety disorder, or actual trauma. You would never, ever wish that upon anyone you cared about. It is it's so destabilizing and literally like a fucking living nightmare. You would never. So whatever that message you're describing, which I have very little doubt that anyone actually feels that way. And if they do, it's just they are literally as disconnected as the let them eat cake queen.
Yeah. Well, it's not that they it's not that they're like, oh, depression, I want to have depression. It's more, I have depression. Not that they the wanting it It's like, no, in this kind of woke liberal thing, being a super successful Tom Brady or Elon Musk is a bad thing to do. So instead, there's an emphasis more on my fragility or my victimness. And then as a result, I sort of think anyone, if you just start to focus on the interior emotional parts that don't feel quite right, you can kind of get lost and paralyzed. Like if you wake up in the morning and you're just kind of tired and you're not feeling good, and you just really go, let's say you wake up in the morning and you're tired and not feeling good, and you happen to have a therapist, a bad therapist sitting right there, and the therapist is like, Porn, how are you feeling? I can tell you're not feeling very well. Go into those feelings. Tell me more about those feelings. You would never get out of fucking bed in the morning because you'd just be like, oh, yeah, I don't feel good. And the therapist is helping you get more into how bad you feel and how you don't want to get out of bed. You can see how it's like this like black hole that you would get sucked into.
Yeah, I do see that.
Versus the opposite, you wake up out of bed, it's early, and there's someone there's like, sorry, Porn, it doesn't fucking matter if you don't feel good. You need to get off your ass, get out there. You'll start feeling better when you just get up and get going, you know?
Oh, yeah.
And so those two different voices, and they're kind of like different cultural orientations to being a human right now.
Wow, I am really struggling right now in this moment. I'm like struggling because I hear what you're saying. I know it's all true, but it's like, it's causing me to have countertransference, like heavy. I'm literally...
Like what? What's your reaction?
My reaction is just like, holy shit. I don't allow myself to embrace this victimized self because it would be my demise. I'm afraid of that.
Yes.
I'm afraid of what would emerge in me. Just like, and I don't think I would... I like in there, I would find some level of like, I would get in touch with a disgust and hostility for humanity. And I think I would act out terribly on that.
Yeah, I think you're right. And I think that's because you've actually had some really fucked up, shitty, traumatic childhood experiences.
Sure.
Whereas the kind of rich, privileged, educated, upper middle class white 13-year-old that's in therapy who's actually just had a really fucking easy life, they can kind of dabble into that dark hole, and it sucks and it's bad for them and it leads them down the wrong road, but they can kind of play with that fire because their fire is so fucking small. But you know that if your fire is not small, you can't be fucking self-indulgent in that way.